So during routine visits, we always do a check for any formation of gum disease, from the mildest form of gum disease, gingivitis, to the most severe form of gum disease, which is periodontitis or periodontal disease. So we always do a good checkup on that as the foundation that all of our teeth are built onto. Beyond that, we look at each tooth for any cavity or decay formation. And that's what can typically cause the traditional toothache, right? Normally, where decay enlarges so much from the outside of the tooth to the inside of the tooth, where the nerve of the tooth lives, if the cavity gets so big, then it is sharing bacteria with the nerve of the tooth. Then that's when we have pain and infection and a toothache. So we always will check for any decay that is forming on teeth, any cavities that are maybe forming in between teeth, and we detect those with x-rays. And visually, we can look at a tooth, and on any of the other parts of the tooth, the what we call smooth surfaces, kind of the outside or the inside or the chewing surface, we detect that by looking in the mouth, just visually with magnification to make sure no decay is forming, no cavities are forming. The other things that we do during a routine, say, hygiene appointment or a cleaning appointment, like a patient would say, is we're looking at um, gum health, tooth health, but also we're assessing and making sure that oral cancer isn't present, that we're taking a proactive view, each time we're looking in the mouth to make sure nothing with the soft tissues, so the tongue or the floor of the mouth or the cheeks or the palate, anything really in this world where we operate in, that there's nothing going on as far as pathology forming or disease forming there that we need to be aware of. So here at Chandler Park Dental Care, we kind of pride ourselves on taking a very kind of big picture view for our patients. So, and not just dentally, but overall health. So we're wanting to take into consideration their medical history, how their oral health impacts their overall health, and vice versa, because there are things with a medical history or medications that patients will be on that will potentially negatively affect their oral health. So we want to make sure that we aren't missing anything with that, or we incorporate that into our plan, certainly our knowledge base, so that we are treating the whole person and doing things or recommending treatments that are going to help them with their overall health.